Hi, I'm Dr. Macon Singletery, your friendly North Raleigh periodontist. We're going to talk today a little bit about a procedure that we do. It's a more advanced procedure, but sometimes there's some questions about why we do what we do. Probably the most important part of periodontal therapy is understanding why we do these things. Root planing is a procedure, deep scaling, gum grafts. We're going to talk about our regeneration protocol, a minimally invasive surgical procedure. And just because it's the S word, don't get apprehensive. And this is why I'm doing the video, is to help you understand a little bit about why we do what we do. First of all, whenever I do anything for you, you're not going to feel anything. You're going to be numb. You're going to be, anytime you have a question or you want me to stop, you just raise your left hand. That means bug off. The procedure that we are doing, where we try to regenerate the gum attachment back to the root of the tooth, is done because of what the etiology of gum disease is. The live bacteria is plaque. That's what it looks like under a microscope. The dead bacteria is calculus. Calculus is the cell wall of the bacteria that when it calcifies, it's like barnacles on a pier piling. We have to physically remove the calculus. That's what we call root planing. You're planing a board, you're smoothing it. You're planing a root, you're smoothing it. Plaque is easy to remove. When we do a more advanced procedure, this minimally invasive procedure, it's done for a reason. And in areas deeper than 5 millimeters, our ability to remove that dead bacteria is compromised. And so what we have to do is pull the gum back. Studies show anything greater than 5 millimeters between the tooth and the gum, you can't get the calculus off effectively. So there's a part of our regeneration protocol involves using the laser therapy. And there are different kind of lasers out there, and they're all not the same. The Waterlase, the Biolase is a laser treatment that we can actually treat the root surface and detoxify it and pulverize, so to speak, the calculus, and then also affect the inflammation in the gum tissue. So the procedure is just for us to get access to the root. Anything greater than 5 millimeters, our ability to get that dead bacteria off is compromised. And so when we do our initial treatment and we evaluate it and then we say, hey, we still got an issue here, that issue is the calculus on the root of the tooth. So whenever I do anything, it's for regeneration, to get the gum to reattach back to the root of the tooth. And the only way you can do that is to physically manipulate that calculus off, and you got to see it. You can't do it by root planing. If you got areas greater than 5 millimeters, some of that calculus is going to be left. So we'll have you numb, pull the gum away minimally so we have access to that root. And then we remove the calculus. We use my laser therapy to affect the inflammation in the gum tissue and to sort of coagulate. That light that comes through the laser tip, it's an erbium chromium laser tip. It absorbs an inflamed tissue and on hydroxylapatite. So the procedure itself is just to get the root clean. So when I put the gum back, there's a clot and there's attachment to the root of the tooth. So it's a procedure that once you're done, because of the laser protocol, it heals quicker, you're not sore afterwards, and hopefully we are able to eliminate that area that's deeper than 5 millimeters and make it easier for you to maintain it and for us to maintain it. Thank you. So keep smiling.